We've been talking about it since the pandemic. Rural hospitals facing tough financial times. A new Arkansas Advocate report is shedding light on new statewide partnerships hoping to reverse those impacts. I sat down with reporter Tess Vrbin to learn more about the latest moves from our local medical providers. Let's start with an overview of the industry, the hospital industry in Arkansas. For those who don't know, who are some of the major players statewide?
Okay, so there's the University of Arkansas for Medical Sciences, which, as the name implies, it's part of the University of Arkansas system. It's a medical school and a hospital system, and it's the biggest state-funded healthcare institution. It has a wide footprint throughout the state, including residency programs in different cities and regions. And then there's also Baptist Health, which is also has a massive footprint. They're not state-funded. They also have a lot of facilities throughout Arkansas.
And so all of these hospitals that are across the state, since COVID wrapped up, or at least since in the last 5 to 6 years or so, hospitals have been facing a number of hard financial times. Why is that?
So, of course, the pandemic kind of overwhelmed hospitals. It tested their resources, having to treat that many patients with a virus that was relatively new. But the federal government did help out a bit by issuing billions in financial aid nationwide. Arkansas itself distributed 60 million of that federal money to rural hospitals specifically, and that did help them for a while to make ends meet. But even as the pandemic died down, the demand for hospital services and labor has kept going up. It has not plateaued or slowed down. And at the same time, insurance payers' reimbursements for medical services are lower here in Arkansas than they are in other states. So some hospitals have had to cut some of their services just to keep their doors open because they are not getting enough reimbursements to cover the costs of their services.
And along those lines, it seems, and you even mentioned that rural hospitals are the ones that are really facing the most impact. Talk about what UAMS is doing now to help with some of these rural hospitals.
So UAMS recently announced that they are going to co-manage the hospitals in Mena on the west side of the state and Helena on the east side of the state. Mena has 25 acute care beds. Helena is a hospital that focuses on emergency services because it actually traded inpatient services for more federal funding within the last couple of years. So those are hospitals that serve relatively small populations. And with UAMS coming in and having some management authority, like that business relationship means these small hospitals will have more access to high quality specialized care because UAMS has more funding, more manpower, and those medical professionals might have to drive a ways to get there, but they'll get there.
Basically, by doing this, it's keeping these hospitals open.
That is part of it. They are helping to keep them open and keep them caring for patients as best they possibly can.
Yeah, exactly. All right, so we all know what has happened with Baptist Health Fort Smith campus. They're a huge deal for the River Valley. They have sold 4 River Valley clinics to another healthcare provider. We reported that several weeks ago. What other moves does Baptist have up their sleeve in making this across the state?
So, like you said, Baptist Health Fort Smith sold some of their clinics to a Northwest Arkansas-based system community clinic. They also cut some jobs and cut the labor and delivery unit from the Fort Smith campus. So their footprint in Western Arkansas and the River Valley has shrunk, but in South Arkansas, their footprint has increased because they acquired the hospitals in El Dorado and Magnolia. So they are also trying to make sure that those hospitals can stay afloat financially and have more specialized care for their patients.
And the reporting and to go back with the situation involving the Mena Hospital, in your reporting, you say that UAMS partnership with Mena is even more important to the western and southwestern part of the state. Talk about why that is and why what the hospital CEOs were telling you.
Right. So MENA is one of the few Western or Southwestern Arkansas hospitals that has a labor and delivery unit. Because, like I said, the one at Baptist in Fort Smith closed in April. There's still a labor and delivery unit in Fort Smith at the Mercy Hospital, but labor and delivery units have been closing since the pandemic. There have been 8 that closed in the past 6 years, and most of those have been in Western or Southern Arkansas. There are still 2 hospitals in Hot Springs that deliver babies. There's one in Arkadelphia, but the one in Camden closed theirs in January. The one in Warren closed a couple years ago. People have to travel pretty far in these rural parts of the state to deliver babies. And if someone's in an emergency situation or if someone has a high risk pregnancy, you need specialized care for that. And UAMS has specialized medical professionals, perinatologists, maternal fetal medicine specialists. CEO Paul Irvin of the MENA Hospital told me that having those professionals is going to be really important for the MENA Hospital to meet the needs of folks not just in MENA, but people who have driven maybe 2 hours to get there to have their babies.
And I think there was, and a part of your reporting may have involved an OBGYN actually closing shop there in Hot Springs as well. So it just seems like it's happening all over the state. So, and I know the focus has been shifted to the future of rural hospitals. What are the main focuses now in keeping those rural hospitals open and moving forward?
There was a bill in the legislature last year that didn't make it out of the House, but it would have raised reimbursement rates that insurance payers pay hospitals. Like I mentioned earlier, it would have at least partly addressed that problem. It didn't advance out of the House. There's probably going to be another effort to get that through the legislature next session. Also looking to the future, what Irvin, the MENA CEO, told me is that hospitals should be prepared for upcoming Medicaid cuts on the federal level. There's going to be a big cut in rural Medicaid spending because of last year's One Big Beautiful Bill. Um, it's also going to put work requirements on folks to receive Medicaid. And those changes are expected to cut a lot of people from the Medicaid rolls. And rural hospitals in that case would probably have an influx of low-income patients with a lot of medical debt. And Urban said that hopefully there will be efforts to try to minimize those cuts, but also to make sure that hospitals have the resources and the finances to care for those patients. So that is something that is coming down the pipeline.
It sounds like the conversation you had with him, he's a little nervous about the future.
Yes.
All right, Tess, thank you so much for your time. Appreciate your reporting, and we'll look forward to talking with you again.
Thank you. Thank you for having me.